Hello, I'm Dr. Atul Deokar. I'm a pediatric nephrologist practicing at Wadia Children's Hospital at Nanavati Hospital. And with me today, Professor Dr. Preeti Shanbag.
Hello, Atul.
Hello. She is at JJ Hospital and she practices pediatric nephrology also. This is being done for ISPNCON 2022 in association with Sir H.M. Reliance Foundation Hospital. A common complaint, ma'am, that patients or parents get their children to us in the OPD is with burning micturition or pain while crying urine, while passing urine. And the symptoms can vary right from a child with a mild discomfort to an extremely inconsolable crying child. So, how do you approach this?
Yeah, actually, it would depend on the age of the child. If it's very often, I mean, the causes can be anything from very simple things like, the child is not drinking enough water and
Right.
passing very concentrated urine. So it could be something simple like that to something quite serious like a urinary tract infection. Again, it would depend upon the age of the child. Very often you find infants coming, the parents tell you that just before passing urine, the child cries. Uh, as long as the child is passing urine, the stream is normal and all, there's some incoordination and this generally passes off with age. So, but it's important in each case to see the patient, take a proper history, examine the patient. So without all these things,
Right, even
yeah,
diapers, right? So
yeah,
nowadays, most of these children are on diapers and they're crying while passing urine. They come to a clinic, we open the diaper, and suddenly, poof, there's so much of diaper rash or diaper dermatitis.
correct. And again, I mean, they don't change the diapers remain red, the skin becomes red, and then the child often has discomfort.
Okay. So, do we investigate each and every child with with these symptoms?
I mean, if they have any obvious cause, no need. I mean, if they're otherwise well, if there are no other symptoms, one would wait. But I mean, sometimes we get older children.
Okay. Yeah, because I got a phone call from a mother of an 8-year-old girl, and she said that she wants to do an online consultation because the child is passing urine, and she was confident that my child has a urinary tract infection. And then I said, as you said, we need to examine the child. So I said, I refused. I said, you need to get the child. When they came to the clinic, when I opened the child up, the 8-year-old girl had proper genital redness, and the redness had spread to the inner aspects of both the thighs with a proper border, like classical fungal infection.
Yeah.
And then I went to the history, and they were wearing non-cotton underwear. So I told them, you change to cotton underwear, keep that area dry, see to it that she passes urine frequently. See to it that she changes the underwear frequently.
Drinks a lot of water.
And drinks a lot of water. And then we just applied antifungal ointment. She got better. I got a urine routine done, but that did not show any pyuria.
Yeah, sometimes even if they have, pinworm infestations and,
Correct.
they're scratching the area turns red. So they could complain of this thing. But another thing, I mean, because recently I saw a child, I mean, the child had suddenly become quiet and she was having severe pain while passing urine. One needs to keep in mind sexual abuse also, especially in, I think boys also, but especially girls. So, I mean, that history has to be taken in some fashion, but one needs to keep in mind that happens irrespective of the class of patient.
True.
Yeah. Then of course there are other conditions like hypercalciuria.
Correct. Because again, there was another boy, a 9-year-old boy, and the history was that twice in the last 2 weeks, this child had a red colored urine along with dysuria. And the only thing the parents did was they gave him a lot of water, and the dysuria cleared. So how does one approach these kind of cases?
Again, nowadays with the diet, with children eating so much processed foods, obesity, high salt and all that, hypercalciuria is pretty common. But of course, if you find that, I mean, when you examine the child again, you find that the bladder is distended and all, keep in mind that you could be dealing with a bladder calculus as well. So that is the other thing. Of course, the main cause of dysuria is, especially in older children, one would always think of a urinary tract infection. Get the urine microscopy done. If there are WBCs, one goes ahead and, with symptoms, pyuria, you do a culture.
Right.
And then, because urinary tract infections can cause renal damage, so one should always be aware that one should not miss this.
Right. So then every dysuria is not a urinary tract infection.
No, again, as I said, one has to take a careful history, examine properly, and then, it is not one thing fits all kind of thing. But one needs to keep in mind urinary tract infection always because
Right.
it's
Because
serious.
especially in infants, right? Many times they may not have dysuria.
Yes.
Any unexplained fever, we take it as a high index of suspicion that this child could be having urinary tract infection.
Yeah,
And
but
the
older
only
children
way,
often come with dysuria. So
right. And is there any way to know whether it's an upper urinary tract infection or a lower urinary tract infection in older children?
no, I think generally we go by the symptoms. If the child is very febrile, toxic, dehydrated, one assumes that it is an upper urinary infection. And this child requires admission and at least intravenous antibiotics to start with. But usually older children, I mean, who don't have a pre-existing renal thing, they generally come with lower urinary tract, symptoms.